Hello everyone, so welcome back. Today's episode we're going to talk about brain aneurysm. You see, brain aneurysm is or can be a catastrophic surgical and medical emergency which can be life-threatening. This is one of the common cause of brain bleeding, especially subacute hemorrhage, right? So after the trauma, it is the most common cause of subacute hemorrhage. Just for our understanding, subacute hemorrhage is a bleeding where there is a bleeding happens over the surface of our brain. And aneurysm is something like a ballooning in your artery which supplies our brain. Although if you look into the data, you found that in normal populations, if you look into the data, you say that hardly 1% or less than 2% can have aneurysms. And most of the aneurysms, this sort of aneurysms, they grow over months to years, and they are asymptomatic. Don't have any problems. I can have aneurysms, you can have an aneurysms, and we don't know exactly that there is an aneurysm sitting there. But as I said earlier, this can be catastrophic. The risk of rupture of an aneurysm inside our brain depends upon so many factors, even our behavior, like chronic smokers or chain smoking, binge alcohol intake, uncontrolled hypertension, genetic predispositions. There are some genetic causes also, the formation of the aneurysms and the risk of aneurysm ruptures. And the most important is like where is the locations, aneurysm, size, and all these things. This matters. So with this video, I just want to share one point is like, if someone is having an incidentally detected aneurysms, you have done an MRI brain or angiography, and then you found that there is an aneurysm inside your brain. Well, you don't be scared about that one, but at the same time you need to take care about that, because you need to consult your neurologist or neurosurgeons or neurointerventionist, who are going to treat for this one, whether that aneurysm is requiring treatment or we just want to follow up. Okay, so all this depends upon, as I say, the size of the aneurysms, where is it located, and what is the morphology. That's very, very crucial point, because something in medical term we say the dysplastic aneurysm or dissecting short of aneurysms have more chances of rupture. And if you are doing follow-up, say for example we have seen an aneurysm and we have done an imaging within months or so, and we found that the aneurysms is very rapidly increasing in size, there is significant increase in size, the risk of rupture increases. Similarly, the history of family history is there is aneurysm rupture or so. So these are the points which we need to understand, and we need to understand and give the importance that if any incidentally you don't have any symptoms and incidentally you detected an aneurysm inside your brain, kindly don't ignore it and consult your doctors. That's very important. And in our other episodes we'll be talking about what can be the symptoms, what are the things we can do at our home, and more importantly, supposedly this aneurysm ruptures, what are the treatment we have, and in unruptured also what are the best treatment we can have, because there are significant dynamic shift, I would say, has made over the years as far as treatment is concerned, because it's not only the open surgery we require now, there are other very effective treatment available, like the angiography we do without opening your brain. We go into the brain and then we can seal that part, we can block that part through endovascular pathway. So we'll be talking in all this in details in other episode. Thank you very much.